Welcome to CareLink SF eClinical Works, EMR Training, OB Flowsheet, Provider Visit. In this video, we will introduce you to the OB Flowsheet, a specialized progress note used to track and manage a patient's pregnancy. The flowsheet is a comprehensive collection of timelines and benchmarks used for the duration of the pregnancy. This video will walk you through the workflow for documenting a provider follow-up or workup visit in ECW. In order for an OB flowsheet to be accessible on the progress note, the visit type must be PN for prenatal. This way, ECW will automatically display an OB flowsheet. Your OB workup or follow-up patients will see an intake nurse or MEA first during the visit. At this stage, they will receive a POC urine test, have vitals taken, and any additional orders stated. Let's begin the provider workflow. When the status reads ready, the patient has finished intake and is ready to be seen by the provider. Verify that the correct appointment provider is listed on the note by looking under the Provider/Resource column. To update the appointment provider from Physician Statistical to yourself, click the caret next to View Progress Note and update the appointment provider to yourself. Update the status to Provider in Room with Patient and double-click to open the note. Please note that if you see this screen when you click into a workup or follow-up visit, that the patient does not have an active pregnancy in ECW. Do not click Create Pregnancy. You'll use a combination of a progress note and a paper prenatal chart to document for this visit. This is the OB flowsheet. While you are in an OB flowsheet, you may access a progress note for the same visit by clicking on PN at the top of this screen. This button will toggle back and forth between the OB flowsheet and a progress note. You will document on both for this visit. The best way to view the OB flowsheet is by utilizing these olives at the top of your screen. Click on the left and right olive until they turn red. This will present the flowsheet in a wider and cleaner view. Each section on the flowsheet displays different information about the pregnancy. Click on the blue heading link for each section to document in that section. The toolbar at the top of the flowsheet allows you to easily navigate by taking you directly to a section within the flowsheet. Most sections of the flowsheet were completed during the initial visit and should be reviewed. A few sections of the flowsheet will be updated throughout the pregnancy. Let's start with Form A. Review and update information here, but do not edit the LMP. Click Save when you're finished. Click EDD to add an ultrasound date and adjust the EDD if needed. Here, use the caret to add the date of the ultrasound and enter the gestational age to update the EDD. If you would like to make this the new EDD, click Select and the initial EDD will update. If you would like to make this the final EDD, click Make Final EDD and add your initials on the right. Click Save when you're finished. Review the past pregnancies grid and update any information if necessary. OB Flowsheet History. Review information here and edit if needed. This section should be locked during the workup visit. Next is genetics. Review and edit this section during the workup. Save this section during the follow-up and lock during a workup visit. Once you lock this section, the information should no longer be updated. Initial physical examination. Review and edit any information here and lock during the workup visit. Next is Flowsheet. Each visit during the pregnancy will have its own line on this flowsheet. Click on the current date. Verify the MEA or RN documentation here. Complete any additional documentation. Add your initials after the MEA or RN and click Lock. Next is Labs. Click Labs from the toolbar. View the lab results from the intake visit and any additional visits here. You can click on the order date to view the lab results window, and click on the pink paperclip to view the entire lab report. To order more labs, select View Care Graph from the top of the labs. Select the appropriate template from the drop-down and click Apply Template. This template is now available in the OB flowsheet. Click on the gray OS, select the appropriate ICD code associated with the pregnancy, and then choose from the labs or immunization that you would like to order. You can also click on Order Labs and Browse Labs to order from all tests available. Choose the appropriate assessment code from the left and search for your lab. Answer any Ask on Order questions associated with this test. Next is the OB problem list. The OB problem list functions as a mini SOAP note for the pregnancy. There are 5 items that should be added to the OB problem list as a standard for CareLink SF. These 5 items will be added during the initial visit and tracked and monitored throughout the pregnancy. Click on the date to add documentation to each section. To document for this problem, click Timestamp and add your notes. Click Save, but do not lock it. You can continue updating other problems from the problem list. Active problems will remain at the top of the OB problem list. Updating a problem to resolved will bring it to the bottom of the problem list. You can also add problems as necessary. This completes documenting on the OB flowsheet. Click on the PN from the top of the flowsheet to toggle to the progress note for today's visit. On the progress note, you can document a more focused examination if needed. You'll need to reconcile the medication list and verify it here. You'll also need to click into allergies, verify the allergies. Verify that the pregnancy is added to the problem list. Click into assessments and verify that the PL is selected. At the end of the pregnancy, when this flowsheet is closed, the assessment will automatically be removed from the patient's problem list. Carry out any additional orders in the progress note from the treatment section. If you're ordering medications, click Add. Select the assessment code and the medication. If you're ordering medications, you may find the 5M in-clinic dispense list order set helpful. Verify any drug interactions. Be sure to e-prescribe your medications. For medications that are dispensed in clinic, click into the Notes section, then timestamp, and type Given. Use the immunization and therapeutic injection links for one-time in-house orders. For billing information, click Visit Code. Make sure that the pregnancy diagnosis is marked as primary. Click Add CPT. Choose Prenatal from the left-hand side, and then select the appropriate Z code. Add any additional CPT codes here if necessary. The CPT codes here should match the paper encounter form that goes with this visit. Add the follow-up information, the duration, and reason here. For warm handoffs or appointments needed with ancillary staff such as social work, health ed, or nutrition, note this in the follow-up section and specify the time frame. When you're finished, return to the office visit screen to update the discharge status. If follow-up appointments or discharge orders are needed, update the status to either ORD, DC, or ORD-RP. If you're the last person to see the patient, check the patient out from the clinic and from the resource schedule. Remember to lock the progress note when all charting is complete within 72 hours. Ensure that you give the discharge staff the time needed to document discharge orders before you lock your note. Thank you for watching OB Flowsheet Follow-Up Provider Visit. For questions or comments, email us at carelinksftraining@sfdph.org.